This week, another historical moment has taken place in the field of Alzheimer's disease with the FDA approval of Eli Lilly's drug called Kisunla. In the phase 3 trial, Kisunla has demonstrated to reduce the cognitive decline with about 35% compared to placebo-treated patients in a period of 18 months. This is incredible news for patients with mild cognitive impairment and early Alzheimer's disease, but it also poses challenges to the healthcare system that we have today. One of these challenges is the monitoring of the side effects called amyloid-related imaging abnormalities with MRI. Compared to Leqembi, Kisunla has 4 safety MRIs in addition to the baseline scan, in which we're going to look for vasogenic edema, sulcal effusion, gyral swelling, microbleeds, and superficial siderosis. And today I want to show you here the importance of AI in the detection, quantification, and grading of ARIA. We look at the FLAIR scan, so we're specifically interested in ARIA-E, meaning sulcal effusion, gyral swelling, and vasogenic edema. As you can see in this particular example, the edema is not necessarily hyper-intense on FLAIR, which makes it very challenging to detect. On the other hand, this is also a process that is diffuse with not clear boundaries that are visible on the images. And therefore, it's so important to use a harmonized way of assessing and quantifying those areas of ARIA-E, and AI, as you can see here, can play a very important role in doing that in a nice, accurate, and consistent way. That's why we have developed icobrain ARIA, an AI-based tool to automatically assess ARIA-E and ARIA-H. For ARIA-E, we measure the longest axis and the number of regions in which ARIA-E is present. And based on those 2 parameters, also an automatically assessment is done of the suggested severity. Below there is some details of our measurements, together also with the volumetric changes. With our reports that are currently FDA pending, we aim to help radiologists and neuroradiologists with a more consistent and more accurate assessment of ARIA, contributing to a better care of patients with Alzheimer's disease.